Hello guys, did you know there are 12 types of diabetes? Diabetes is a complicated condition which can take many different forms. In addition to the more common types of diabetes like type 1, type 2 and gestational diabetes, there are a range of other types of diabetes which are just as important. The first type is type 1 diabetes. Blood glucose level is too high because your body can't make a hormone called insulin. This happens because your body attacks the cells in your pancreas that make the insulin, meaning you can't produce any at all. We all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our body. When you have type 1 diabetes, your body still breaks down the carbohydrates from food and drinks and turn it into glucose. But when the glucose enters your bloodstream, there's no insulin to allow it into your body's cells. More and more glucose then built up in your bloodstream, leading to high blood sugar levels. The second one is type 2 diabetes. With type 2 diabetes, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. This means your blood glucose levels keep rising. Around 90% of people with diabetes have type 2. It is a serious condition and can be lifelong. Having type 2 diabetes without treatment means that high sugar levels in your blood can seriously damage parts of your body, including your eyes, heart, and feet. These are called the complications of diabetes. But with the right treatment and care, you can live well with type 2 diabetes and reduce your risk of developing them. The third one is gestational diabetes. Gestational diabetes is diabetes that can develop during pregnancy. It affects women who haven't been affected by diabetes before. It means you have high blood sugar and need to take extra care of yourself and your bump. This will include eating well and keeping active. It usually goes away again after giving birth. It is usually diagnosed from a blood test 24 to 28 weeks into pregnancy. The fourth one is maturity onset diabetes of the young, MODY. MODY is a rare form of diabetes which is different from both type 1 and type 2 diabetes and runs strongly in families. MODY is caused by a mutation in a single gene. If a parent has this gene mutation, any child they have has a 50% chance of inheriting it from them. If a child doesn't inherit the mutation, they will generally go on to develop MODY before they are 25, whatever their weight, lifestyle, ethnic group. The fifth one is neonatal diabetes. Neonatal diabetes is a form of diabetes that is diagnosed under the age of 6 months. It's a different type of diabetes than the more common type 1 diabetes as it's not an autoimmune condition. The sixth one is Wolfram syndrome. Wolfram syndrome is a rare genetic disorder which is also known as DID-MOAD syndrome after its four most common features like diabetes insipidus, diabetes mellitus, optic atrophy, and deafness. The seventh one is Alström syndrome. Alström syndrome is a rare genetically inherited syndrome which has a number of common features. Eighth one is latent autoimmune diabetes in adults, LADA. LADA is a type of diabetes which seems to straddle type 1 and type 2 diabetes. Bits of it are more like type 1 and other bits are more like type 2. That's why some people call it type 1.5 diabetes or type 1.5 diabetes. It's not actually classified as a separate type of diabetes at the moment, but there's some medical research going on to try and pinpoint exactly what makes it different from type 1 and type 2 diabetes. The ninth one is type 3C diabetes. Type 3C diabetes is a type of diabetes that develops when another disease causes damage to the pancreas. The conditions related to type 3C are pancreatic cancer, pancreatitis, cystic fibrosis, or hemochromatosis. You can also develop type 3C if you have part or all of your pancreas removed because of other damage. The 10th one is steroid induced diabetes. Some people who take steroids can go on to develop diabetes. This is known as steroid induced diabetes and is more common in people who are at high risk of type 2 diabetes. The 11th one is cystic fibrosis diabetes. Cystic fibrosis diabetes is the most common type of diabetes in people with cystic fibrosis. Although it has features of both type 1 and type 2, it is a different condition. The last one is monogenic diabetes. Monogenic diabetes is a rare condition different from both type 1 and type 2 diabetes. It's caused by a mutation in a single gene. If a parent has this mutation, their children have a 50% chance of inheriting it. Since monogenic diabetes is so rare, people can often get misdiagnosed.